Loneliness and social isolation was a huge problem for older adults during the pandemic, but a new poll by the University of Michigan finds many are still struggling. The national poll on healthy aging, supported in part by the AARP, finds a third of older adults sometimes feel lonely or isolated.
We've learned over the years how important our emotional well-being is to overall health, and loneliness and social isolation can have a number of really negative effects.
1 in 3 people between age 50 and 80 say they sometimes or often feel isolated or go a week or more without social contact from someone outside of their home. And those percentages are much higher for those with physical or mental health challenges, says senior poll advisor Dr. Preeti Malani.
Some of the groups that are most affected include those who report fair or poor health, or have a chronic health condition or disability. And in those individuals, the numbers are really astronomical.
The poll finds social isolation in older adults is decreasing from a high of 56% in 2020. But experts say it's still too high. Dr. Malani says we can all help.
We can all do a better job of checking in with friends and family who may be isolated and feeling lonely. We've lost touch with some of the people that we love, and it's a good time to check in. Check in on your parents, your grandparents, your neighbors. Ask them how they're doing. Go and visit them. Get a cup of coffee or even give them a phone call.
For those still at a high risk from COVID,
I would still advise trying to find ways to move forward, trying to find ways to have interaction. It may be using technology, it may be with smaller groups, it may be meeting people outdoors, but find ways to improve your social interaction, since that's also essential to our overall well-being.
Dr. Malani says healthcare providers should be asking about loneliness and social isolation as part of routine care and referring lonely seniors to their area agency on aging or other community resources for older adults.